Hey, everybody.
Good evening, good afternoon.
Hello. Hey, Leah. Hi, Liz, Desh, Marty, Alexis. How's everybody feeling? Woo! It's go time almost. We have a couple more people. I see um, uh, Cameron Cal, Brent Troxel, and Francis Mejia. Um, are you early or Cameron Calvis, Sid from Stell. Okay. Hi, Sid. I just promoted you to panelist, so go ahead and accept. Nice work. Okay, and then Brent and Francis, are you early birds or are you with one of the finalist companies? You can go ahead and put your early. Okay, great, Francis. We're starting at 5. So we're just doing a little quick run through with the companies. So this part might not be that exciting, but you're welcome to hang out and watch the behind the scenes sneak preview. And then Brent Troxel, I'm guessing is also early. It doesn't sound like any of our finalists here are claiming him. And then Lauren, I see you on. I'm trying to promote you to a panelist. I'm not sure if you're at your computer or not. There you are. Okay. Hi, Lauren. All right. So we have our 6 finalists. Woo, woo. We're all here. So the way this is going to go is when we set this up so that it will follow the host view. So when you're we're going to keep it on gallery. I'm actually going to take you all off as panelists until it's your time to come up and speak. So that process of accepting that promotion to come on and be panelists will bring you up, introduce you, all of that. And then I will mute my video and we'll change it to speaker view. So your face will be the main one, and then you'll share your own slides unless you need our help sharing them. So want to just go through what I'm just going to call on your squares. And if you could just practice sharing your screen real quick with your slides, make sure everything looks good. So Dash, you are in my first top corner. So would you share your screen real quick? Nice, looks great. And go ahead and just say hello so we can make sure we hear you.
Hey everyone. Yes,
Sounding awesome.
okay.
All right, your slides look great. Thanks, Dash. All right, Marty, you're next. Perfect. And say a couple words so we can just sound check you.
Good evening.
Lovely. All right, Sid and Sandy, you're up. Thanks, Marty.
I think Marty might need to unshare.
Oh, I have to unshare. Got it.
Marty,
I just did.
cool. Can you guys hear us? Mic check 1, 2.
Mic check sounds great. Slides look great. You guys look great. You're kind of matching. I love it. Wonderful. Nice work. Oh, and then are we still, Sid, are we still doing Cameron's Zoom too, or just did you change your name or what happened there? I just want to make sure I got
Yeah,
that right.
I changed my name. I can re-enter with my link. I was just trying to, I was
Oh
waiting.
no, that's perfect. I just want to make sure. So as long as your name's right, I'll know who to bring up because I'll just click on that to bring you up as panelist. All right, Liz, you're next. Looks beautiful. Love it. Quick sound check for us, please.
Testing, testing, testing. Good evening, all.
Sounds amazing. The sound quality, you guys, professionals. All right, Lauren, hello.
Right. All right.
Looks good. Go ahead and make it full screen if you can. We're seeing your Chrome browser. And we see your download there at the bottom. That cuts it off.
Sure how to do that. I'm not sure how to do it and be in presenter mode. Does that make sense?
It
So-
does make sense. If you open up your PowerPoint, I can walk you through real quick.
It's not PowerPoint, it's Google.
Oh, I see. Well, go ahead and X out. You see at the bottom of the browser window where it's showing your Hazel Health PowerPoint download.
Oh, yeah.
Get rid of that. That looks better. What happens when you click on the green maximize button? Over on the left, the like one that would expand the screen all the way.
Like this one.
Yeah. There you go. That looks great.
I think that I have to double check though, because then I can't see any of my notes.
Oh, okay. Okay. Well, it looks fine how it was before, too. That looks good.
One thing you can try on the share screen, there's an advanced option when you click share screen where you can share a portion of the screen. You can try that as well.
I think when I click share, it gives me the option to choose like my screen or a window. So I chose the window.
There should be the next tab over.
Hold on, let me stop sharing and see if I can do it again. Okay, advanced. I see.
You want to
Got
try that? That's what I do. I share a portion of the screen because I use Google Slides as well.
Got it. So how do I
You just have to set
how do I set the size?
usually pulls up like a green.
Yeah, I see the green box, but I'm not seeing how I
can-
change the size of it.
You can drag the edges of it. After you set it the first time, then you don't have to reset it the second time. If it's too complicated, I think the way you had it before was fine too.
The way you had it before was good. I don't want to throw you any curveballs, right?
I know
So,
I've like practiced it in my Zoom, and so I'm like, I thought
No,
I
it looks good. Just make sure that bar is gone from the bottom of the browser if you download
Okay.
anything else. And if needed, I'll let you know if we need to troubleshoot it when you start. It's not a big deal.
Okay.
All right, looks good. And you sound great. Looking great. All right, Alexis, hello. Beautiful. And a quick sound check, please.
Can you hear me? Okay.
You can. Yeah, sounds good. All right, wonderful. All right, everybody. Our checks are good. Everyone's looking great. We are live streaming on YouTube. Not that anyone is watching that, but just so you know. It's for the socials. And then yeah, so the run of show, we're going in alphabetical order. So let me see if I can remember how to do the alphabet. So that'll be Marty, Dash, Lauren, oh my gosh, Alexis, Liz, Sid. Did I get that right? Oh, I can do the alphabet. Darby has our notes. She's right behind me, but it's blurred. Here, I'll give you a quick preview.
think I go before Dash.
Yeah, there's Darby. She's doing our run of show and all of those things. So she's making sure that we're on track.
All right, so I have Marty and then Hazel is.
We can just, as long as we have the
You guys
list,
have
we're
it in
going
the
in
emails,
alphabetical
too.
order and it's in the email. I just said it wrong. So that is all good. So we'll start with just some quick, short opening remarks, welcoming everybody, giving people a chance to join. Some thank yous to our judges and providers and the Colorado Health Foundation, a few words about the challenge. And then we will start with our first company, which is Marty. I at least know that. And then Marty has 6 minutes to pitch. You all have a 10-minute slot. So if you go a little bit over on your pitches, that's okay. It'll just shorten your Q&A time a little bit. So we'll just do 10 minutes. There's typically like a 1 to 2 minute transition. I will take you all off as panelists until it's your time to come up, at which time probably like right as the person who just has pitched is doing their Q&A, we're going to promote you to a panelist. Go ahead and click that link when it's time, that button, and then join. We will introduce you quickly. I'm probably just going to say our next pitch presenter is Open Source Wellness. Take it away, Liz. Do any of you, actually, quick question, for how I refer to you in the public setting, does anyone have any titles they prefer I use? Any doctor or esquires I should know about or anything like that?
I have their names as they'd like them.
Perfect. Darby has my script over here, so I read that, but great, just checking. And then after we do the pitches, during which time the judges will be able to an audience will be able to put their questions in the chat. There is also a form, a digital form that they are voting on for their bids. We also, for some of our provider organizations that couldn't make it, but wanted to make sure they let us know they were interested in piloting with you, they submitted their bids in advance. So we have all of those. Pretty cool. We got some from UC Health and a few others. So we will share after the competition, regardless of whether you win or not, we will let you know who bid on you, who is interested in piloting a solution with you, and facilitate those introductions and all of those things. So we keep all of that information. From there, once the final, I'll be moderating questions, by the way, and your MC. So from there, once we do the last Q&A, we collect the results, get everyone in, and during that time, we do the People's Choice Audience Award, where we open up a poll and then the audience can vote. While we're doing that, my team and I review all of the final bid counts, do some deliberations, all of those things, determine who the winners are, throw that on a slide real quick. We have pre-made slides. Anyway, we get our slides ready and then we come back and then we announce the winners and the prize amounts and, lots of thank yous and congratulations, all of that. And then thank you and have a good night. And then we will follow up with all of you tomorrow with your information and next steps. Probably won't do much tomorrow though. And I am out next week for family time for Thanksgiving. So we'll follow up with all of you with more information the Monday after we get back from Thanksgiving. So that's kind of the timeline. And we'll make sure you have anyone's information that bid. We'll let you know who that was, how many you got, all of those things. And that is the thing. And then for all of you, just so you know, all of you have had a ton of interest from the community. You really are 6 amazing solutions. All of you are excellent. There is a lot of excitement and enthusiasm around the work that you're doing. So give yourselves a pat on the back. Out of 50 companies, you're the top 6 in Colorado, according to hundreds of people. So woohoo! Thank you for going through this process with us so far. We have loved getting to know you all better. We love your solutions. I have leads for all 6 of you and interest already for all of you. So whatever happens tonight, something good will come out of it. And you're amazing. And all of our semifinalists, finalists, and winners, we continue to work with and support and stay engaged. You're part of the Prime Health family now, so Definitely, like, this is hopefully not the end of a beautiful friendship. So just want to start out with saying that I hope you all go into this evening feeling confident, um, feeling proud of what you've accomplished so far. Go into this knowing that lots of people voted for you. This year was really interesting in that you all were pretty consistently like in the top 5 every round, like right up there, and every round in the top 10. So this was an interesting year of people just really like what you're doing. So shake it off. And then the other thing is that we are doing this event at 5 p.m. on a Thursday. It is a very stressful time in our healthcare community right now. So one of the big things that we shoot for with this event is energy. So if you're not standing while you present, I recommend that you consider standing while you present to give yourself a little more juice. Try to stand up and shake it off for a few minutes before you go on so you can have your energy up. Be excited about what you're pitching. There are about 300 people attending tonight. So it is a large audience and many others who already put their bids in for you already. So that's kind of the other big thing I can tell you is it's easy to remember. It's easy to forget when you're pitching on a Zoom webinar or when you can't see all the people in the audience, how many people there are, but close your eyes, pretend you're on a stage, and just rock it. You're all badass. So that's my pep talk. And now we have about 30 minutes. People are going to start trickling in, all of those things. Darby and I are going to go do some final prep. Do you have any last minute questions for me or Leah before we go? Alexis, I saw your hand first. Go ahead.
Yes. So one of our co-founders will be joining, can't join right now, but will be joining for Q&A. I told him maybe like 7:45 before, at least before, I'm sorry, I'm thinking on East Coast terms,
Sure.
about 20 minutes before we're supposed to go on. He'll be able to join. I just wanted to be able to confirm that he will be able to be added as a presenter at that time.
Yeah. Just when he joins, just send Darby and I a chat with his name so we know who it is.
Perfect. Okay. Thank you.
No
Yeah,
problem.
I'm in the same boat as well. Jim Lindstrom will join. He's not going to present, but if there's a question during Q&A, he might answer it.
No problem. It is completely easy to bring people up. We just need those names in the chat. So before, what I would say is when you're getting ready to come up to do your pitch, like when you're next, whoever is there from your team that you want us to be ready for in Q&A, we'll just plan to automatically bring them up as panelists while we're taking that first question so that it's all smooth. So just let us know our names. Other questions?
Do you want us to stay logged in now and just go like off camera until we start? Or how do you want us to do the next time?
I'm going to take you all off of panelist now. So we won't be able to see you or hear you. And so you won't need to go off camera. But yeah, I would leave this open. So we'll just take you off panelist and then we won't, your video and audio won't be on there anymore. Anything else? All right, my dudes. Woo! Challenge. We're here.
Thanks, Rachel.
Thank you. Congratulations. Also, just kudos to Leah on our team who's been doing all the provider outreach. She has, I don't know if you've all had a chance to meet her yet, but she has been working her magic for all of you. So she's a really amazing asset in Colorado. She's muted, but I think she's telling me like more and more. Tell me more about how awesome I am. All right, she's still muted.
Okay, no, I'm unmuted.
Okay.
No, basically, we've just been reaching out to organizations, convincing them that they do have enough capacity to take on pilots that have resources behind them, and that they've got time to do it. We're not making anyone sign on the dotted line tonight, but even with what so many providers are going through, a lot of them are excited about you guys. We've gotten questions about specifics. We've gotten questions about generalities. People still want to innovate and try new things to make the services better.
Yeah.
So if you have any questions during the webinar, I am not a tech guru, but if you message me directly or message Darby, we can help you if you get kicked off or you're having trouble with something, or at least I can get you to someone who can help you with the technical stuff.
Thank you, Leah. Awesome. Okay, so I'm going to go ahead and kick off all the panelists. And I'm seeing that we already have 21 people in the audience. So to all of you early birds, hello. Welcome. Thank you for being here. I see a couple of hosts in the audience. Whoop, whoop. Oh, and David Brody. Hi, David. So seeing lots of wonderful people. Panelists, or finalists, I'm going to let you go. Or, well, yep. So change role to attendee. There you go. We will see you all soon. And to our audience, hello and welcome to the 8th Annual Prime Health Innovation Challenge. We are so excited to see you all. The show does start at 5. We'll be coming back on at about 4:55 to, get everything rocking and rolling. But in the meantime, grab a beverage, grab a snack, and get comfy. We will be kicking off the show here very shortly.
And I've also heard from a few people who are child caring while they're
Hello, everyone, and welcome to the 8th annual Prime Health Innovation Challenge. We are so excited to see so many of you on here. We have a really exciting show for you planned tonight with 6 incredible solutions. We will be getting started at about 5 p.m. Feel free to go ahead and introduce yourselves in the chat. Let us know any questions you already have, just waiting for our finalists to pitch. I saw we had some friends joining us from Utah, and I know there are other people from all over the country joining us tonight. So let's all say hi in the chat. Let us know who's here. We have quite a few people joining. A little over 300 registered for this evening, though, so we're going to give people just a few more minutes to trickle in. In the meantime, if you want to learn more about this year's challenge, the Prime Health Innovation Challenge, which is powered by the Colorado Health Foundation, you can head on over to our website. I will put that link in the chat. Go ahead and check out primehealthco.com/challenge to learn more about Prime Health, about our incredible finalists, our judges and hosts, and of course, the fantastic Colorado Health Foundation who powers this event. So again, welcome everybody. Go ahead and get comfy, grab your beverages, grab your snacks, say hi to each other in the chat, and I will see you back here in just a few minutes. Whoop, whoop. Hello, everyone, and welcome to the 8th Annual Prime Health Innovation Challenge. We are so excited to have you all here with us tonight. Thank you for joining us and being here. We're so excited to hear from these 6 amazing Prime Health Challenge finalists, the top 6 digital health solutions in this year's class of amazing companies from all over the world. Who have been competing for the last 6 months for the chance to win a portion of prize funding provided by the amazing Colorado Health Foundation and the chance to pilot their solution with a Colorado Safety Net provider organization. We are so happy to have you all here with us tonight. We're just giving everyone a few minutes. We have quite a few people attending and joining us virtually, again, from all over the country. So we're just letting everybody take a moment to join. In the meantime, I love seeing everybody introducing themselves in the chat. Hi, Daniel. Hi, Jeff. I love seeing our fantastic board members here. We are so excited for all of the finalists as well. Really 6 amazing solutions. And it was tough competition. We had a lot of really phenomenal organizations this year. Hi, Jan, great to see you. So hi, Flo. Oh, I love all of this. And Fatima and Amal. Hi, we have on here Carrie Coach with the Director of the Office of eHealth Innovation. Really excited. The Office of eHealth Innovation will also be, so for those of you that don't know, I'll just talk about Carrie a little bit and the amazing Governor's Office of eHealth Innovation for the state of Colorado. We call them OHI for short. OHI, it's OHI. And they are an agency with the state that helps to facilitate and lead much of our digital health and health innovation focused work across Colorado. And I am honored to be an eHealth commissioner, along with several of the other participants we have joining tonight, including Dr. Wes Williams from Mental Health Center of Denver, also Prime Health Board member. Hi, Wes. And I know I saw some others. The chat is really going now. So hi, everybody. Welcome. But back to OHI. OHI this evening is honoring us with an OHI's Choice Award. So they'll be looking at the 6 pitches and evaluating that from the perspective of which of these solutions might have potential to help advance Colorado's health IT roadmap. For those of you that don't know but are interested, which I'm sure is many of you, OHI just released a new version of the health IT roadmap. Really exciting, lots of amazing priorities, obviously very heavy on the digital health and health technology. So Carrie might go ahead and put that link in the chat for all of you if you want to check that out. And we'll be sure to share that out later in the evening as well. So great to see you, everybody. Hi, Vinu and Ollie, so many of our fantastic judges. We also have the fantastic Camille Harding here with Colorado Department of Human Services. Hi, Camille. Hi, everybody. So wonderful to see all of you. Ben, I'm just reading Open Source Wellness's co-founder. Ben is asking if his twins can vote too. Hi, Sarah. Oh, wonderful. So many, just really a great audience with us tonight. So excited to get started. Oh, yes, and there Carrie posted the new HIT roadmap in the chat. Really recommend that you all give that a read. It is going to be really exciting. There's a lot to do over the course of the coming years. Okay, so a few housekeeping things, and again, people are still joining, so I'll probably say this twice, but just a few things in terms of how the run of show is going to go. So tonight we are joined by our 6 amazing finalists. So for those of you that aren't familiar with the challenge program, our finalists go through a 6-month program where They are evaluated, vetted, judged, coached, mentored by a community of more than 100 Colorado healthcare, technology, and innovation experts, leaders, and influencers. So a lot of really amazing and diverse perspectives. And then during this process, they also learn more about Colorado's unique health ecosystem. What are the big initiatives that we're working on? What are some of the priorities? How do we make these solutions sustainable and align them with our health economics? And all of those different things. So these 6 solutions are out of that 6-month program, the top 6. So we're really excited to hear from them tonight. They will be pitching for 6 minutes each with about 4 minutes of question and answer period after. So each company will have 10 minutes on our virtual stage. We will be going in alphabetical order. So we'll be starting with Augantel, our first presenter, who will be bringing on at 5:15. There will be a break between the first 3 pitches and the second 3 pitches for you all to grab a drink of water, stretch your legs, whatever that looks like. During that, after all 6 pitches go, we will have a period for the People's Choice Award, which is where we'll post a poll here in Zoom, and so that you as the audience can choose who is that People's Choice Award winner, which of the top 6 pitches that you heard was your favorite. We'll also, during that time, be doing our deliberation to come back and announce the winners at 6:50. And then from there, we will aim to wrap up at 7. So that is the run of show. Oh, and then I just see in the chat the amazing Dr. Ben Bynum. Hi, Ben. Hi, Dr. Ben, from the Colorado Health Foundation. And so just again, want to say thank you and how much we appreciate the Colorado Health Foundation, who has been making this nationally recognized, nationally leading challenge event happen for 9 years now. So the Prime Health Innovation Challenge is powered by the Colorado Health Foundation. And this program has allowed Colorado, Prime Health, Colorado Health Foundation, and the many, many judges and provider organizations and companies that participate to lead the nation in safety net innovation. So thank you, Colorado Health Foundation. Thank you, Dr. Ben, for being here. We're so glad to see you. And thank you for the kind words. And then hi, Brandon. So I see many of our fantastic hosts in the chat. We have Jefferson Center, we have Aurora Mental Health, we have Mental Health Center of Denver, we have Colorado Coalition for the Homeless. Hi, Andy. Just so many, Children's Hospital, Clinica Colorado, all sorts of great people. So thank you all so much for being here. It is really a wonderful event. We have so many impressive people in the audience. I always get a little bit nervous because there's so many of you are so cool. So welcome to everyone. So now that we are getting a little bit closer to our kickoff time, I am going to go through just a few kind of quick thank yous, some housekeeping notes, some different links. For those of you that are judges. So if you are here in the audience tonight as a safety net provider organization who will be helping us determine which of these organizations you're most excited about, you're most interested in hosting a pilot with in the coming year, all of those things. If you, as our provider organizations, and you have all of this in your email and your calendar invites, but if for any reason you need any support whatsoever during the event, feel free to reach out to Leah at primehealthco.com, or you can message Darby directly in the chat. So we have our phenomenal operations manager and logistics queen, Darby Fornasero, in here. You can go ahead and send her a DM if you need any help, any links, any questions, anything like that. So other kind of housekeeping items for our attendees, you're welcome to comment in the chat for everyone to see. You can DM us directly. You also have the option to put questions in the Q&A. The way that question and answer period will go after each of the pitches, there will be a period for Q&A. I'll be moderating that. So if you have questions that you want to ask, go ahead and put those in there. We will be prioritizing questions from our provider organizations who are evaluating these solutions in terms of potential interest in a pilot. But we'd love to see all of that. So go ahead and put that in there. A couple of accessibility things. You do have the ability to live transcript this session in Zoom. So down at the bottom, you'll see CC for live transcript. If you turn that on, it will enable live transcription of the event so that you can see closed captioning. So let me know if you have any questions with that. Or if you need any support related to accessibility. We also, for those of you who would prefer to view the pitches and the challenge in a language other than English, go ahead and send Darby a message in Zoom and we will walk you through how to use some of those other features. But in the meantime, thank you and welcome. So let me share, I'm just checking the chat to see, great. So I just want to start with just a few quick thank yous. So in the past, I have been involved in the Prime Health Challenge almost every year since I started. I think since it started, I think I missed the first 2 years, and I think this is my 6th or 7th year. But the thing that I love about this event, before when I was a judge and a host, and now in my role as executive director of Prime Health, the thing that I love so much about this event is that it is a true community collaboration and is really a testament to the incredible, collaborative, welcoming, supportive, sharing ecosystem for health innovation that we have here in Colorado. So over the course of the last year, we have had hundreds of people participate in proposing solutions, identifying things that need solutions. Hey, can you go recruit us some cool solutions for this that we'd like to see in the challenge? We have people who help us with our rubrics to make sure that we're evaluating these companies in a way that's most aligned with Colorado's safety net health ecosystem, with potential impact. We have our incredible judges. And so let me just share a slide with you on that. Judges that represent all of these organizations and a few more actually. So everyone from Colorado Healthcare Policy and Financing, Department of Human Services, Office of eHealth Innovation, Office of Behavioral Health, to foundations like Colorado Health Foundation, Zoma Foundation, Next 50 Foundation, universities and academic institutions, provider organizations, consultants, investors, technologists, cybersecurity experts, nurses, medical assistants. It's a humongous community effort where people come together and say, which of these solutions really work across our broad ecosystem, really have the potential for impact, really get us excited, where we think they can be impactful, sustainable, and scalable, and improve the health and wellness of Coloradans, and in particular, Coloradans who are served by public health systems. So thank you to all of our amazing judges, our host organizations and provider organizations. And then also just, as always, we are year 2 into this pandemic. And so just want to recognize our provider organizations in particular, and all of our healthcare professionals, and just say thank you for all of the work that you are doing. And thank you for being here tonight. It is a testament, I think, to this community effort. There is a lot going on in healthcare right now between the COVID surge and capacity issues. We've heard from many of our host organizations that this is an incredibly challenging time. So thank you all so much for being here, for your wisdom, your insight, your dedication to keeping Colorado healthy, and just for being rock stars. So we're so excited. We are going to go ahead and kick things off here in a minute. And also, I just want to say again, thank you so much to the Colorado Health Foundation Without you, this event would not be possible. This is a nationally ranked health innovation challenge. We, in the last couple of years, due to the recognition of this challenge, have been asked to advise federal agencies, HIMSS Global Maternal Health Equity Challenge, and numerous other organizations around the country on how do we engage a community, bring people together, learn from these different perspectives, and work together to identify common solutions to common problems that are actionable, sustainable, scalable, and impactful. So this is a really exciting work. I'm honored to be a part of it every year. Thank you so much. Thank you, Colorado Health Foundation. Thanks, Dr. Ben. Thank you to our judges, our hosts, our community. We just love you all so much. And thank you to all of our incredible companies that came through this year. It was really, every year is a tough year, but every year the solutions keep surprising us with their creativity, their originality, their innovation, all of those things. So thank you to everyone that participated. We love you. We're so glad you're with us tonight. We are excited to get started. If you have questions, please feel free to put them in the chat or in the Q&A. And now I will be welcoming our first pitch presenter to the stage, Marty Ilisco, CEO of Augentell. So let's all give him a warm welcome in the chat, make him feel comfy, and I am going to go ahead and bring him up. So welcome everybody. Thank you for being here, and let's all give a warm welcome to our brave first pitcher, Marty from Augentell. So he's going to be joining us here in just a moment. Wonderful. Come on up.
There we go. Hello, everybody. I'm Marty Ilisco, CEO of Augentell. Healthcare data, and Medicaid data specifically, has a very large problem. 80% or more of data about patients is not easily accessible. This is because it's narrative data, I might call it unstructured or free text data, that's buried deep in EMRs, case management, and care coordination systems. In Colorado, at least 1.4 million people are enrolled in Medicaid and are cared for by tens of thousands of clinicians. Put yourself in the shoes of a therapist, care coordinator, home health nurse, or caseworker. You are passionate but overworked. You only have 5 minutes to prepare to visit with a patient, and you're afraid you're going to miss something. Multiply that by the 50 to 100 patients you care for, and now you are experiencing what it's like as a clinician providing care to individuals with complex social and health conditions. I suspect many in the audience know this problem all too well, especially in Colorado, in the context of the current staffing crisis, where 30% or more job openings remain unfilled, and the remaining 70% are tasked with picking up the slack. So how would an organization go about addressing this problem? How do you reduce staff burden and maximize the abilities of the staff you already have? The answer is to use cutting-edge AI software to sift through patient notes and present information such as critical risks, social determinants, and strengths, and do this simultaneously across multiple systems like EMRs and case management systems. What you get is the widest possible view of data about a patient with the most critical information delivered to you. You can see our applications in action here. The bird's eye view is especially needed in Colorado, where multiple organizations typically collaborate to deliver care to a single patient. And the overworked therapist I mentioned before can now quickly and easily have the deepest possible understanding of the patient so that they can be as confident as possible about the decisions being made. Along with confidence comes decreased anxiety and decreased clinician burnout, which, as we all know in the context of COVID, is a nationwide crisis that is yet to be addressed. I'll come back to this later, but as you'll see throughout my presentation, in Colorado, we believe we are a fit with community-based providers, FQHCs, RAIs, social HIEs, and organizations that have a stake in achieving the goals of Colorado Senate Bill 19222 to build out the Colorado Behavioral Health Safety Net System. Allegheny County, home to the city of Pittsburgh, is known as one of the top government social services organizations in the country. Allegheny has multiple case management, care coordination, and homeless management systems, and all contain disparate information about a single patient. Instead of the pain of logging into all of these systems to piece together information, the therapist instead uses Augantel. On the screen shown here, a county therapist acquires a whole patient view, identifies social determinant of health interventions, and importantly, has Google-like search capability for all of the data across the systems, a capability they never have had before. And on the screen shown here, a supervisor, quality specialist, or administrator receives early warning signs, monitors for quality issues, and receives information to make data-driven policy decisions. Prior to working with us, this was 100% manual and frustratingly laborious for Allegheny, and we work with them to solve it. Similar to Allegheny, we are working with social services organizations across the country, including the State of Hawaii Department of Human Services and other large community-based organizations similar to those in Colorado. They all experience the same problem, are looking for modern workforce multiplying solutions for their staff. Importantly, clinicians love working with us. But as a side note, when a clinician understands patient histories, the patient isn't asked to retell his or her story, and patient satisfaction increases as well. I've shared a few quotes. An associate director of dependency said, "Supervisors are excited because it makes their lives easier." And a senior case manager said, "This helps me be more informed and is so easy to use." We know our effect on staff satisfaction, but how do we impact quality of care, and what is the financial return of working with us? We deliver a 25% increase in patient understanding, a 50% reduction in document review time, a 2x increase in care coordination opportunities, and a 10% reduction in employee turnover. Additionally, organizations improve sharing of patient data. They can better mitigate risk through early warning sign detection. They can improve quality score measures and improve revenue capture. When developing applications for social services, it is critical that the team developing them understands the nuances of the clinician's job. To that end, we have built a diverse team of clinical and technology experts who develop our applications and work closely with you to pilot and roll them out. I'll point out a few. Prior to joining Augantel, Kathy Hankey dedicated her career to social services as a practitioner and executive working at both government and community-based organizations in Illinois. She is our customer success manager. Jim Lindstrom, our VP of product, has led product management organizations in social services tech and others in AI, a unique mix of experiences at the cross-section of what we do. We are very proud of the collaborative relationships that our team has developed with our customers. To that end, we are looking to collaborate with 1 to 2 Colorado organizations. We believe we have a strong fit with community-based providers and FQHCs who employ passionate but overworked clinicians like the person I described earlier, who need a deeper understanding of their patients and who are interested in providing modern tools to their staff that they love to use, that decreases their stress and administrative burden and helps them maximize the quality of care they deliver. We also believe we have a strong fit with Raise and Social HIEs who need to get a complete view of patients across providers, ensure care is properly coordinated, and to maximize quality measures. We also support any organization, government, private, or nonprofit that has a stake in achieving the goals of Colorado Senate Bill 19222 to build out the Colorado Behavioral Health Safety Net System. In wrapping up, we would like to thank Prime Health. Working and learning from everybody over the past 6 months has been wonderful. And we're excited to collaborate with organizations in Colorado to give clinicians the power to deeply understand their patients and to maximize the quality of care they deliver to those most at risk in Colorado. Thank you from the entire Augantel team.
Wonderful. Thank you, Marty. Well done. I just love what you're doing. Wonderful pitch. Awesome. All right, audience. Oh, I see we're getting some rounds of applause. Yeah. Let's give Marty some props. Okay, and so for our audience, for our providers, and our healthcare leaders, what questions do you have for Marty? I'm going to go ahead and take this question from Dennis first, but start thinking about those questions and putting them in the chat. But Dennis asks, have there been studies of the quality and lack of bias in the AI used to sift through large amounts of data to provide the product? So have there been studies on the quality of the data?
With that, I'm going to hand it over to Jim Lindstrom, our VP of Product, and he's going to talk about our relationship and work in Allegheny County, working with Carnegie Mellon University on our work with them.
Great, thanks.
Hi, this is Jim. Yeah, we are actively working with Allegheny, as Marty mentioned in the presentation. They've brought in Carnegie Mellon to help advise them. And one of the things we're working on with them right now is a rigorous study of the accuracy of our AI. We believe that it's high from anecdotal work with other clients and their feedback, but this will be a chance for us to get academic publications out of this, proving that to be the case. So stay tuned. We should have those publications shortly.
Great. Thanks, Jim. All right. Next question is from the one and only Andy Grimm from Colorado Coalition for the Homeless, one of our veteran hosts. Hi, Andy. He asks, are you able to access data sources outside of an organization's own EHR and systems, like maybe a hospital partner's EHR? Or is this only a solution that can work on systems controlled by the organization?
The answer is the former. So if you and your staff have permission to access data in those systems, then by proxy, we have permission as well and can integrate the data across those systems into our interface that you've seen throughout my presentation.
Great, thank you. And then Flo Ritano. Hi, Flo. Flo is from the Denver Regional Council of Governments. Flo asks, has this platform been used to enhance services to at-risk older adults?
In our communities, we've been working in the early stages with adult protective services. In Hawaii, their services are provided to both child and adult populations. So the answer is yes.
Great, thank you. All right, and we have time for just a couple more questions. So next question is, does Augentell have capacity to recommend care decisions?
We explicitly do not recommend or predict anything in our product. What we do and what we focus on is giving clinicians the information they need to be informed and make the best recommendations as possible.
Great, thank you. And Aliris, Director of Innovation from Mental Health Center of Denver asks, hi, Aliris, by the way, how does platform use differ between staff use and management use?
We have two elements of our product. The first is used by frontline staff to understand individual patients. And the second, our oversight dashboard, is used by leaders and quality specialists and supervisors to look at data across a panel or across a service line or across an organization and give a view of how service is delivered to that particular population.
Great, thank you. Last question is from Fred Campy from Denver Health. Hi, Fred, great to see you on here. Fred asks, is this system accessible from within an organization's EHR, or is it a separate application?
We have a number of different ways where our data can be accessible. It can be its own application. It can be launched within an EMR, or if the customer so desires, we have APIs to send data back to EMRs to be presented within that user interface.
Great. Thank you, Marty. Thank you, Jim. We will go ahead and move on to our next pitch. Really well done. And then for our judges, please go ahead and put in your bids for Augentell if that's a solution you want to vote for. If you have any questions about where to access that form, go ahead and send our via chat. And now we have up next Josh. Hi, Josh, and welcome. Josh is with Hazel Health. So I will go ahead and let you share your screen and take it away. Welcome, everybody. Let's give Josh a warm welcome. And Sean, I see coming up as well.
Yeah, and there'll be one more panelist, Lauren Dunn, will be with us.
And Lauren. Okay, we've got a whole group. Welcome to Hazel Health. Augentel, you're welcome to keep answering questions I see coming in the chat, but let's go ahead and everyone give our full attention to Hazel. So go ahead and share your screens and take it away.
Great. Hi, everyone. Good evening. My name is Lauren Dunn, and I am the Director of Education Partnerships with Hazel Health. I'm thrilled to be here with you this evening.
Lauren, I'm so sorry to interrupt you, but your screen isn't sharing right. It doesn't look like it's just showing a black
okay, hold on. Apologies. Hold on one second.
No
Try it again.
And while Lauren's pulling this up, I'll do quick intros on our end. So I'm Josh Gollum, I'm Hazel's CEO. Also with us is Sean Bradley and Lauren Dunn. Really excited, and hopefully the technology will support us here in a second to share with you what we're working on. And if Lauren, for some reason, we need for me to give it a try from my computer, I'm happy to. And maybe while we're pulling this up, I'll go ahead and start to share. So Hazel, so we partner with school districts to bring telehealth to kids right while they're in school to help increase access to both physical and mental health services. We'll be showing you a little bit of color on this in a minute, but just to give you a little bit of story on the background of how we got started. I have a background in healthcare. Actually, I used to lead a company based down there in Denver. Used to be called Paladina Health, now called Eversight Health. And a lot of our work was focused on the work that we've been looking at Hazel is how do we help increase access for kids. And Lauren, before going on, let me just check to see how the technology is working for you there. Oh, but you're on mute, Lauren.
Darby on our team is Hazel. We're pulling up your slides to share them for you. So
thank you
unless
so much.
Lauren, you have them handy, but if you do, go ahead and start sharing. Otherwise, we'll have slides in just a couple seconds to load.
No problem.
Okay, I think I figured out the issue. Great. Does that work?
Yes, it does.
Yay. Awesome. Thanks so much, everyone. Apologies for the delay. Good evening. My name is Lauren Dunn, and I'm the Director of Education Partnerships with Hazel Health. I'm thrilled that you have a chance to meet with our team this evening. Thank you so much to Prime Health, the Colorado Health Foundation, OHI, and all the hosts for this opportunity. So we'll dive right in. Obviously, you met a few of our folks, including our CEO, Josh Gollum, who's on the line with us today. So Hazel Health, we are the most trusted telehealth provider for K-12 schools. We were designed with schools, for schools, and we provide both physical and mental health care to students. My professional background is in leading our K-12 schools, most recently as a senior executive team member for Denver Public Schools. Those of us who work in schools, work with school-age children or have school-age children, we know well how large the health needs are among our kids, especially, with their mental health needs 2 years into this pandemic. But even before the pandemic, the gaps in healthcare access were already acutely felt by many families across the country. Wait times to see a PCP have typically been a month or longer and are even longer now. And while half of children have public insurance across the nation, most providers only accept private insurance or cash payment. And accessing care has always been even more challenging for our BIPOC students. We know that Black students are more likely to be impacted by chronic diseases like asthma and more likely to then miss large amounts of learning time due to those health issues. And our Black students who are under the age of 13 are more likely to die by suicide, or twice as likely to die by suicide than their white peers. Today, during COVID, we are seeing urgent indicators of an epidemic of mental health need. And in districts we currently partner with, we hear stories daily of how strong this need is, how long the wait lists for care are, and how the situation is adversely impacting children's academic learning and performance. So what can we do about these pediatric health challenges? Hazel Health is a virtual telehealth solution that is built to meet students' needs, both mental and physical, where they are, when they need it. So how does it work? During the school day, we partner with schools to provide access to care. Our physical health services are available on demand in the school health office, and we design them with school nurses and health aides to fit within their workflow. A student will come in with a complaint, and the nurse can call in a Hazel provider over video chat. That average wait time is less than 3 minutes. And then the student and the Hazel provider can connect. This provider can assess the student and determine the appropriate next step. That might be providing an OTC medication, calling in a prescription to a local pharmacy, or referring that student to a local provider for further evaluation and treatment. Really, the goal is to get that student the care that they need immediately, and if possible, get them back to class and learning. Our mental health services are also acute in nature, but they work a little bit differently. We really focus on filling the gaps, ensuring that all students will have timely access to mental health care. Right now, many of our students are waiting weeks and months to see a provider. So we partner with school counselors, psychologists, and social workers to identify students who could benefit from teletherapy. Those staff make the referral. We follow then up with the families and the students to get those students set up for a behavioral health assessment. After that assessment, our program essentially acts as sort of a student assistance program. We provide up to 6 teletherapy visits, and those sessions can take place at home or at school, and a diagnosis is not required. Then following the discharge from our student assistance program, our family resource managers continue to support the student and the family for 6 months, following up on any referrals that were made, and as well as overcoming any social determinants of health that may be preventing that student from accessing further care. We provide all of the necessary equipment for our in-school services. Real estate is super valuable in our school buildings, so we've designed Hazel to be extremely compact and easy to accommodate within the school health office. And our health technology was designed with school nurses and families as well, so it's incredibly user-friendly. It's both HIPAA and FERPA compliant. Our system integrates with existing student information systems that districts are already using, so that data transfer is very easy. Our platform serves as our EHR, and we're able to share a significant amount of HIPAA compliant usage data with our partners. We also provide customer support for our schools throughout the life of our partnership. And Hazel is available at home. That way, students and families can access services before school, after school, and when remote learning, so directly from their home computer. So what does Hazel achieve for our students? Our model works because we focus on the whole child needs of the student. We're designed to integrate seamlessly with schools, and our telehealth platform is easy to use for school staff, families, and students. Also, our access is universal to all students in the district, regardless of their insurance status. Additionally, we believe cultural competence and diversity is an absolutely critical component to increasing health equity. We are focused on ensuring that we are increasing capacity within local health ecosystems by providing greater access to diverse providers. More than 40% of our providers are people of color, and across our provider team, more than 14 languages are spoken fluently. Currently, we partner with 5 school districts here in Colorado. Super thrilled with all of these partners. And to date, we've worked really hard to make a positive impact on increasing student access to healthcare, increasing attendance and learning time for those students we serve, and providing services that satisfy families, reduce the number of hours that parents are missing work, and reduce the number of costly ER trips for the community. With our mental health care access, we've seen amazing results. We've been able to reduce the number of days it takes for students to see a provider from many weeks or months down to fewer than 7 days. And our services are most frequently used by students who are historically underserved. An independent study by the US Department of Education found that Black students were most likely to use Hazel's telehealth services, and our Hispanic students were most likely among all students to utilize Hazel for preventive wellness services that they might otherwise forego. So we would love to partner with you to increase healthcare access for more students across Colorado. In particular, we're really eager to work with partners who could help us create economies of scale to serve more rural districts in Colorado. And in our typical model, we charge an annual student fee to the district or the partner. And when possible, we bill third-party insurance while also covering all costs for families. So we're super eager to hear what ideas and opportunities you might have for how we can work together. So with that, I will pause for questions. Thanks so much, everyone.
Woohoo! Well done, Lauren. Wonderful job. Thank you, Hazel. We have some questions already, but congrats and way to recover from the fun, exciting world of troubleshooting technology. So Hans Mueller, hi Hans, great to see you. Got his question in first. So Hans's question is, what is your reach to kiddos doing a homeschooling situation? For example, when they're not enrolled at a local district?
Yeah, that's a great question. So typically we partner directly with school districts. And so there are a number of school districts who have homeschooling programs. So we'd work then with that school. You know, there's usually a school administrator for that homeschool program, and we can provide them access to Hazel through the Hazel at Home program.
Thank you. All right, next question. How do you share information with PCPs or other providers to ensure continuity of care?
Yeah, that's also a great question. So we do provide summary discharges and other information to PCPs. It's particularly important for us as we identify students who have a PCP to make sure we're connecting back with those providers. So usually we work with them to provide it in the best possible way for them. Sometimes that's through more sophisticated systems, and oftentimes it's simply faxing it over.
Nice. Next question. How has Hazel been able to make this idea cost effective for school districts?
Yeah, that's also a great question. I'll turn that one over to my CEO, Josh, see if he would like to respond to that.
Thank you, Lauren. Yeah, and so what we're finding with our school districts is, so first, there is funding coming in right now. There's more and more dollars available for school districts where they're being asked to take on more and more, specifically around mental and behavioral health. And for some school districts, are using that to hire staff. And some school districts actually need more than that because some of the funding is not long-term. So to create a sustainable model, they're trying to balance bringing on more people full-time and to bring in other resources, particularly when there's smaller schools that can't afford a full-time person. And they're trying to increase metrics around diversity that Lauren mentioned. And so the idea is we're often using these funds that may only be available for 2 or 3 years to get the program started. But then the health plans are the ones that make the program sustainable over time, because whenever we can, instead of getting reimbursement from a school, get reimbursement from the health plan, we do. And we never doubled up, and that's what brings the cost down over time to our school district partners.
Awesome, thank you. So we have time for 2 more questions. I am gonna go ahead and do Hans's follow-up. So Hans is asking, regarding info sharing, are you sharing to Colorado's health information exchanges, for example, Creo?
Yeah, great question. Josh, do you know the answer to that question?
Yeah, we are not yet today with that health exchange, but we are excited to do that in the future.
Great, thank you. All right, and last question. This is from Dr. Daniel Carnegie, and he says, what is the process for referring patients who require a higher level of care than the telehealth visit?
Yeah, fantastic question. So certainly when our providers identify patients who need care that cannot be handled over telehealth or longer term care, we typically will work with the school district and the partners that they may have in existence, local partners, to make those referrals. And we'll also work with other providers that we get to know within the community. And our goal really is to strengthen that medical ecosystem, ensure that students have a PCP, that they're seeing them regularly, and that we are making connections within the community and really filling those gaps rather than, taking on care that isn't quite right for telehealth.
Great. Thank you. Thank you so much, Hazel. That is all of the time we have. So we are going to go ahead and switch over. So if this were an in-person event, we'd be like music, you guys would go off stage and Desh from Coda would be coming up. So we are instead doing a bunch of clicking. So we're doing all of that. So thank you all so much. Hazel, there were a lot of really great questions in the chat and in the Q&A. You're welcome to go ahead and answer those. To all of our amazing hosts, you should all have your link. If you don't have your link, send Arby and I a message. And don't forget to vote as we go along. And now we have the amazing Desh from Coda Health. So Desh, take it away.
All right, thanks so much, Rachel. Can everyone see my screen and hear me? I'm gonna take that as a yes.
Yes, we can.
All right, wonderful. Hi, everyone. My name is Dr. Desh Mohan. I am the co-founder and chief medical officer of Coda Health. And I'd like you to take a moment and think about your loved ones, maybe a parent or a spouse. Do you know what kind of medical care they would want if they became seriously ill? As a physician and hospitalist, I've been in the room taking care of these critically ill patients who have been admitted to the hospital. I know firsthand how difficult these moments can be. Patients often aren't able to voice their wishes any longer, and family members are left lost, wondering what to do. And while you might think you know what kind of care they want, studies show the likelihood of you picking what they would have wanted is only around 50%. These results are, of course, personally devastating to patients and family members, but this disconnect is also egregiously expensive to payers and health systems who spend over $100 billion annually delivering care that patients don't even want, just in the very last year of life. Now, traditionally, planning for future healthcare has fallen to estate planning attorneys, or those people proactive enough to pursue direct-to-consumer solutions. But these approaches ignore the quality of the conversation. They cut doctors out of the process, and they tend to target those people who can afford it. But most people can't. The oldest and poorest are among the highest utilizers of healthcare, and they don't have access to these solutions. And although 80% of patients want to discuss this with their doctor, only 7% actually do. And it's not just because physicians don't have the time. These conversations are difficult, they're uncomfortable, and they require specialized training and documentation tools that they just don't have. And a further worrisome trend has shown that due to multiple factors, vulnerable populations, including the underinsured and underrepresented minorities, are half as likely to complete their advanced care plans. These are unfortunately the same populations that COVID is disproportionately affecting and who need these services the most. At Coda, we knew we had to make this process easy, engaging, and accessible for everyone. Coda is a patient-facing web application that digitizes the whole process. Introduced by the physician in the health system, Coda bridges the digital divide and does the conversational heavy lifting. Using motivational interviewing and personalized content, we help patients navigate these discussions with their loved ones and providers. Patients are taken on a journey where they're able to explore their values, identify a medical decision maker to speak for them if they're not able to speak on their own, indicate their quality of life and treatment preferences, and all of these responses are automatically captured to seamlessly create the medical and legal documents like their advanced directives and medical power of attorney forms that protect their choices. These are documents that they can access, update, electronically sign and notarize and share from anywhere for free. And by digitizing the process, not only do we make it really easy for physicians to introduce this to their patients, but we're also able to streamline the billing and documentation necessary for physicians, allowing staff resources to be allocated more efficiently, all while providing actionable patient and population level insights. Coda increases value for health systems in multiple domains. Not only does Coda streamline the workflow for clinical teams, making it incredibly easy for physicians to introduce this conversation at scale, but Coda also makes it easy for these teams to access highly underutilized Medicare and Medicaid reimbursement codes for advanced care planning, adding up to $80,000 in additional revenue every year per provider. By introducing Coda in the health system, we help bridge the digital divide, increasing access to these services for vulnerable patients, which has been demonstrated to significantly increase patient and family satisfaction. And ultimately, Coda helps patients receive the care that truly matters to them, reducing unnecessary utilization by 25%, saving up to $10,000 per patient towards the end of life. And due to this value, we've attracted leading health system customers and partners from across the country, like Houston Methodist, Techstars United Healthcare, and the National Science Foundation. And these stakeholders are seeing the difference. When people engage in quality, guided conversations, the metrics that matter go up. Our pilots have seen a 35x increase in advanced care planning, with a significant increase in advanced directive completion for African American patients who have historically had limited access to this process. And over 75% of patients have identified and share their wishes with a medical decision maker, a key metric of success in this field. But most importantly, our patients, many who have been meaning to get around to this process but haven't for one reason or another, are so grateful for being able to stay in control of their healthcare journey. Our co-founding team was specifically recruited and matched by the Texas Medical Center to address critical needs in healthcare. We're a team of scientists, doctors, and engineers, and each of us has had hundreds of end-of-life care conversations before ever writing a single line of code. And our experience and support by the Texas Medical Center and by United Healthcare has also attracted a star-studded group of C-suite level executives who recognize the massive cultural shift that's happening in this space. And we're so excited to partner with the Colorado Health Systems. If you are a system interested in increasing access to this process for your Medicare or Medicaid patients, we'd love to work with you. We're able to deploy Coda in multiple different ways. And this is just a snapshot of our two most common methods of deployment and our average pricing. On average, we deliver a 3x ROI for our partner health systems. At Coda, we believe everyone deserves to stay in control of their healthcare journey, and we believe the health systems in Colorado can help us make this a reality. Thanks everyone for your time. Happy to take any questions.
Thank you, Dash. Well done. Wonderful pitch. Thank you so much. And we will start taking questions for Dash. I do see one in the Q&A. Go ahead and give Dash some love in the chat. Please put your questions in the Q&A. So first one from Carl. Dash, how do EMS responders get access / see a person's directives? They are often the first responders at the home where care decisions need to be done.
Yeah, absolutely. That's a great question. So the systems that we work with, for example, if it's the health system, we're able to make sure that the care plans are accessible for those systems. But the most important thing that we focus on is actually making sure that the patient's loved ones know these decisions. At the end of the day, it's not the document like an advanced directive that makes the difference. If a patient comes in critically ill to the hospital, it's really not in standard of care for an EMS provider or a physician to go and look for an advanced directive. The most common course of action is for them to turn to a family member to wonder what to do. And so the most important aspect that we really focus on is ensuring there's great alignment between the patient and their family members. And doing this in a digital fashion really helps increase that alignment and helps patients be able to share those wishes with their loved ones.
Thank you. Awesome. Okay, next question is from Daniel Stein. How do you handle obtaining HIPAA consent and sharing that across healthcare providers locally and nationally?
Yeah, absolutely. That's a great question. So our platform itself is HIPAA compliant. And so whenever a patient enrolls into the platform, they go through a consent process and they're able to provide the details that allow us to share their information with only those individuals that they give approval to. So one, the platform itself is completely secure, and two, we only share those details with those that they have provided consent to.
Great, thanks, Dash. Okay, next question. How do you address, this is from Tom, how do you address these recent JAMA articles which conclude that advanced care planning does not improve end-of-life care, nor does its documentation serve as reliable?
Yeah, that was a great article by Sean Morrison. So Sean Morrison outlined 8 different barriers in advanced care planning. And I think one thing that he highlighted was that's really advanced care planning that's the status quo and standard of care. But if you really take a deep dive at the 8 barriers of advanced care planning, what you realize is when you bring technology into this process, 5 of those barriers are automatically eliminated. So if you really study advanced care planning with tools like CODA, I think you can really remarkably change the efficacy of advanced care planning, and it makes it completely different. So I think with tools like what we're using, it's remarkably different.
Thanks, Dash. All right, last question from Daniel again. How do you handle FERPA and HIPAA consent requirements?
Yeah, absolutely. I think similar to the previous question, you know, one, the platform itself is HIPAA compliant, and two, with regards to being able to share the details of a patient's care plans, patients are able to indicate which patients, which caregivers or loved ones they'd like to share their information with, and we're only sharing the information, their care plans with those individuals. So security, HIPAA is incredibly important to us, and so you know, we're very careful about that.
Great, thank you so much. Dash, wonderful presentation. Congratulations again. We love the work Coda Health is doing. You definitely have some more questions in the Q&A, so I encourage you to answer those. And in the meantime, thank you. And just a quick question for any of our hosts, go ahead and put your, let us know, go ahead and put your bids in the voting form for our amazing 3 presenters. Thank you, Dash. Let me see, how do I, there we go. All right, everybody. So we are at the halfway mark. Thank you, Dash. Congratulations to our brave first half of pitch presentations. We now will have a short break. We will be back at 6:05, so about a 10-minute break to do the second half of our pitch presentations, our People's Choice Award, Ojai's Choice Award, and announce the winners. So go stretch your legs. Feel free to put more questions in the chat. Engage in that Q&A. Do what makes you happy, and we will see you back here at 6:05. So in about 7 minutes is how math works. All right, see you all then. All right, everybody, welcome back. Are we still here? Can we get some welcomes, some congratulations and woohoos for our next fantastic team? We have MedTrans Go with us. So we have with us founder Dr. Obi and the amazing Alexis. So welcome, Dr. Obi and Alexis. Woohoo! The audience is pumped, seeing some activity in the chat. Thanks, everybody. We are so excited. So, Dr. Obi and Alexis, if you would please go ahead and share your screen and take it away. Thank you.
All right. Thank you very much. So while Alexis gets started, my name is Dr. Obi Ogunale. I'm a practicing orthopedic surgeon, and MedTrans Go was founded based on an experience that I had with cancellations 15 years ago, 6 years ago. And so it's really been an incredible opportunity for us to help increase access to care. So Alexis, go ahead and take it.
So hello, my name is Alexis Mitchell, and I lead the Community Impact Initiatives for MedTrans Go, a health tech marketplace for optimizing patient outcomes. Dr. Ugonali, as he mentioned, is one of our founders and a practicing orthopedic surgeon who had 2 canceled surgeries 6 years ago in one day due to transportation and language barrier issues. He wasn't comfortable putting his medically vulnerable patients in a rideshare, and there was no on-demand solution for medical cancellations that disproportionately affect female, low-income, elderly, and minority patients. Upon doing some digging, he found that our healthcare system loses $150 billion every year in missed appointments, and lack of transportation and interpretation account for over 50% of those missed appointments. In fact, every year, 3.6 million people don't obtain medical care due to transportation barriers alone. In Colorado, that's over 300,000 people who are prevented from getting to their appointments due to lack of transportation. In addition, 312,000 Coloradans are classified as limited English proficient. For these patients, missing their appointments affects their lives. There's a 3-time increased risk of death by missing more than 2 appointments for those with chronic conditions, and a 40% increase in risk of neonatal death for mothers who don't receive adequate prenatal care. So MedTrans Go is a HIPAA-compliant one-stop solution for missed appointments and improving health equity. We provide transportation, including wheelchair and stretcher rides, and interpretation in over 100 languages, including Spanish and American Sign Language, so that patients don't miss their needed appointments due to these barriers. We also provide telemedicine services for patients that can't physically make it into the facility, and medical delivery to make sure that patients have access to medications and equipment when needed, as to not further delay care or following their telemedicine appointments. We have innovative technology for healthcare, in which we work with healthcare providers to coordinate care on behalf of their patients. We connect those providers with our network of service partners, and then we handle all the operational support. Our web and mobile platforms save healthcare providers valuable time in their daily operations by removing the burden of contacting and scheduling our various offerings with multiple different companies, and is co-designed considering the historical needs of marginalized patient populations. Our solution also allows customers to request, access, and organize all of their patient care coordination in one central location. Multiple service lines can be requested for a patient at once, and details are automatically dispatched to providers, patients, and our service partners. The average request takes less than 2 minutes to schedule, and over 90% of requests are accepted by our service partners in less than a minute. We have over 230 customers and service partners across 8 states, including UC Health Memorial Cancer Care in Colorado Springs, who recently said, the relationship with MedTrans Go has proved to make life easier for the oncology support services team. We are fortunate to have MedTrans Go assist our patients. For our customers, we achieved a 55% reduction in their cancellation rates in 2020. And so far in 2021, we've provided over 3,000 safe and reliable transactions. And so the pilot that we'd like to talk to you about today focuses on reducing barriers in maternal care, as women's health issues don't get the attention that they deserve, and the number of needed appointments increases during this time. As many of you know, hospital closures are a major blow to access to care for rural patients. There's a 49% increase in postnatal mortality in rural counties compared to large urban counties. And in Colorado, 54% of rural counties completely lack OB services. 40% is the percentage of pregnancy-related deaths for Coloradans who die in the year postpartum. And poor continuity of care and care coordination is one of the most frequently cited contributing factors in pregnancy-related medical deaths, suicides, and overdoses in the state. And so this is where our solution comes in. If a patient doesn't have access to reliable transportation, they might miss needed prenatal appointments, not know about their risk factors, or be able to monitor their condition, ending up in the hospital and delivering too early. And not only does this impact the health of parent and baby, but it is also extremely costly. Maternal complications cost society around $32 billion a year. But with MedTrans Go, that same patient might be able to make their needed appointments, learn of their risk factors, and have a doctor monitor and treat their condition, leading to minimal complications and a safe delivery. MedTrans Go is able to take the solvable problems of this patient to lead to better health outcomes and ultimately lower the cost of care. And so for this pilot, we like to partner with one of you to study improved health outcomes of patients in this space by providing services for providers who provide services for maternal patients who are low income, rural, and or limited English proficient over the course of a year and a half. We'd like to measure a number of things, including the number of visits these patients access based on provider recommendations and the reduction in their cancellation rates, detection and effective management of their health outcome or their health problems, and patient satisfaction, and provide a formal clinical cost-benefit analysis for these patients. We believe that use of R4 services by participating providers will increase the frequency of attended visits and access to necessary medication, and will improve health outcomes for these patients. We have the ideal team for this pilot with extensive experience in healthcare, technology, reproductive justice, and healthcare logistics. And through this pilot, our team will be able to move the needle in maternal health outcomes. Once successful, we can use this data to address the critical care needs of even more patients, especially those that require frequent and consistent access to care, but are coming up against these aforementioned barriers across the state of Colorado and beyond. Thank you.
Woohoo! Thank you, Alexis. Well done. Great pitch. All right, so we will now do some Q&A. We already have a few questions in. First is from Flo from Denver Regional Council of Governments, and she's asking, who are you partnering with to provide transportation? In the Denver area, we've lost transportation providers for our older adult population because of inability to attract drivers. We have dollars available for transportation that go unused because there are not enough transportation providers.
So we partner with primarily NEMT providers throughout the state, but we also partner with others who provide transportation, including first responders, EMTs, as well as others who were able to meet our stringent 10-point certification for providing medical transportation.
Thank you. Andy Grimm from Colorado Coalition for the Homeless asks, are you only interested in engaging in a maternal health pilot, or would you consider other pilots with organizations that do not provide a large amount of prenatal and maternal care?
We would certainly consider pilots for other patients that require consistent access to care. We are very much interested in making sure that patients who need that care on a regular basis, but are missing those appointments, are getting the care that they need. So absolutely.
Great, thank you. And Andy, I know you're with the coalition. If you have a follow-up, go ahead and put it in the chat. Meanwhile, Darlene Taddy, hi Darlene, with Colorado Hospital Association asks, what is the role of your program in postpartum care?
And for postpartum, what we are primarily focused on is making sure that patients are getting to their appointments and that they are accessing necessary medication. So for postpartum patients, it would be the same for prenatal patients, making sure that they are getting to their appointments, that they are getting any necessary medication that their providers are prescribing, and as well as providing telemedicine services if they need to speak to their primary care or need to speak to a provider via telemedicine as well.
Great, thank you. And our last question is, and Andy did respond back, that's great. Individuals experiencing homelessness face extreme challenges related to access to reliable transportation. Very true. Charisse asks, this really has the possibility to mitigate social determinants of health. How will you track efficacy, and how will the data be shared?
There are a number of ways that we could track efficacy through either EHR integration, through regular meetings with the individual providers and sharing information that way, through sharing information through our platform. It really depends on the providers that we're working with, and we would want to work with them to find the solution that works best for them in sharing that necessary information.
Yeah, in our access to data is available to our customers. So through our platform, our customers can actually access their data to find out what are the reasons for cancellations and things like that. That could further give them insight on what further things they can do to improve access to care for their patients.
Thank you, Dr. Obi. And actually, one more question. We have quite a lot of barriers around rural transportation and people living out in rural areas. And can you speak a little bit to how MedTransGo has supported transportation access in rural communities and how that might work here in Colorado?
Yeah, it's an interesting question because that's actually one of the things that we pride ourselves in being able to do. Because we partner with non-emergency medical transportation companies, they're frequently close enough to rural areas that they're able to go to almost any rural area. We recently provided transportation in a community of 100 people. So these are places where there's no Uber or Lyft. In addition to NEMTs, we're now working with recruiting first responders and also CNAs that could be there to provide those services. So further deepening our ability to be able to provide transportation to people that are in rural areas.
Amazing. Thank you, Dr. Obi. Thank you, Alexis. Really well done. And if anyone has more questions for MedTransGo, go ahead and put them in the chat. And next up, we are so excited to welcome Open Source Wellness to the stage. So thank you so much, Dr. Obi and Alexis. We're excited to see you soon. Congratulations. And welcome Liz, who is joining with us. Just a moment. Let me bring her up. Dun, 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 dun. Go, Liz. That's right. Here she comes. All right, we've got Liz coming on. Hi, Liz. Thanks for joining. All right, so presenting to you now, Elizabeth Markle from Open Source Wellness. Take it away.
Thank you so much, Rachel. Really grateful to be here. And hi, everybody out there. I'm Dr. Elizabeth Markle. I'm a psychologist and professor of community mental health, and I'm thrilled to be here presenting on open source wellness. So before I get into the nuts and bolts of what we do, I want to orient you to the 4 major outcomes that we're committed to achieving with all of our partner organizations that are listed here. And the other thing you should know that's not on this list, but that's symbolized by our logo, is that open source wellness is fundamentally not a digital solution. We are a human connection solution, or as we like to say, community as medicine, that happens to be enabled by some very basic technology. So here's where we come from. I worked in federally qualified health centers where I watched providers verbally deliver what we now call behavioral prescriptions. They would say things like, you should exercise more, you need to eat better, reduce your stress, and get some social support. And then unfortunately, they would say something that sounds like, good luck with that, I'll see you in 6 months, take care now. Now, to be really clear, this is not the provider's fault. This is the best they have available to them right now. But it's a tremendous equity problem because our patients who have money and privilege might start shopping at Whole Foods or hire a health coach. And for our patients who don't have those privileges, this is a prescription to nowhere. And it's a way that despite our very good intentions, we perpetuate staggering health disparities. So all of that said, in 2016, Dr. Ben Emmert Aronson and I co-founded Open Source Wellness. We are an Oakland, California-based 501c3 nonprofit with a mission of transforming healthcare and health outcomes in partnership with the communities that need it most. And we do this by functioning as a behavioral pharmacy or a delivery system for one universal prescription, which we abbreviate Move, Nourish, Connect, and Be. So here's what it looks like on the inside. Patients are prescribed participation in open source wellness, and the initial dose is 16 weekly virtual groups. These groups are experiential, meaning we don't tell anybody what they should do. We do it together in community and we make it fun. The groups are transdiagnostic, meaning we don't have the depression group and the diabetes group. We have groups for humans who by their nature have strengths and challenges with their well-being. And the whole thing is facilitated by health coaches who are culturally and linguistically relevant. We're currently providing services in English and Spanish, and more languages coming, and are trauma informed. So since 2016, we've been delivering these services in California. We recently expanded to Washington and Vermont. And if you look at some of these logos of our partners, you'll notice that they're very different kinds of organizations. So open source wellness can be implemented in clinical, community, low-income housing, corporate, even peer-run contexts. And the cool thing is that almost no matter what context you implement it in, you get similar outcomes. So here's a sample of about 755 FQHC patients. We're seeing significant increases in daily servings of fruit and vegetables, similar weekly minutes of exercise increase. For those participants who join us with an elevated PHQ-9 score, we're seeing about a 50% reduction in symptoms of depression. For hypertensive patients, we're seeing substantial drops in systolic blood pressure. And then here's the data that really captures the attention of our payer partners and those who are already at risk for outcomes and expenditures. We're seeing about a 77% drop in emergency department visits after participation in open source wellness. So for potential partners who are already in these value-based care arrangements or who have the programmatic funding allocated to achieve outcomes like these, let's talk. But some of our very favorite partner organizations are FQHCs, who tend to have tremendous mission alignment with us, but are still in fee-for-service agreements. So I want to share briefly about how this works with clinical partnerships. The key here is virtual group medical visits. So when we partner with a clinic, the first thing we do is train all of the providers in the clinic to prescribe into OSW. And we teach them to say to appropriate patients, something like, I'm going to write you a prescription, but it's not for medication, it's for participation in a community. When our team of health coaches receives that prescription, we get to work on building a relationship with those patients. We handle all the onboarding, we train them how to use Zoom if they need that, or we support them in calling in via a landline if that's most accessible. But all this engagement is handled by our team, so the clinic doesn't have to do it. The patient then joins their weekly 2-hour experiential group where they move, nourish, connect, and be every single week. And during that 2-hour period of time, one primary care provider who's an employee of the clinic pulls patients aside using breakout room technology for short individual medical visits. When the time is over, they then chart and bill for each of those visits. In between weekly visits, our coaches are providing a ton of phone and text support and gathering the outcomes data that we will then analyze and feed back to the clinic. Now, I want to quote the one and only Jeff Helton, who said to us, "If I'm the CFO of an FQHC, you need to show me how you're going to improve my bottom line today, not maybe somehow tomorrow." So here's how this works out for some of our FQHC partners. Open source wellness groups are large. They have up to 24 participants and 4 coaches per weekly group. And on average, the provider can see and bill for 15.2 patients per weekly group. Now, if that provider were doing individual visits instead for the same amount of time, they'd be averaging about 7.5 visits. So that's an extra 7.7 patients per week per group, which, depending on your PPS rate, translates to about $96,000 of extra revenue per year. Even if you take out the cost of an annual clinical contract with OSW, which is about $81,000, you're still clearing about $15,000 of additional revenue, and that's just for one group. So some of our clinic partners do an English group and a Spanish group, a daytime group and an evening group, and really make this work for them. So we're all familiar with this classic care pyramid with primary care as the foundation. And part of what we're seeing nationally is that PCPs and their support staff are already overburdened. They are expensive and we can't hire enough of them. One of the things that partnership with Open Source Wellness does is that it essentially bolsters the whole clinical care pyramid with this robust foundation of support underneath it, comprised of care coordination, coaching, and community. So when I look at this as a model of care, I can't help thinking about the Colorado Behavioral Health Blueprint for Reform. Open Source Wellness is poised and ready to advance a number of these specific priorities named in this report. And some of them are listed here, but in this final moment, I want to highlight the last one, workforce maximization, and take a moment to introduce the real team behind Open Source Wellness, our health coaches and our peer leaders. So our newest adventure at Open Source Wellness is piloting a health coach training program that will create an employment pipeline so that our patients can become our peer leaders, who can become nationally board certified health coaches that are qualified to work with us or anywhere else. So I'm reminded of the words of Shoma Stout, who a couple years ago said, "Our work is to liberate the trapped and untapped resources lying dormant in our communities." My job at Open Source Wellness is to create structures that channel and uplift the creativity and the wisdom and, frankly, the love of these incredible humans. So our lived experience doing this for 5 years now is that community is the medicine. It's not a side effect, it's the active ingredient that animates really basic wisdom like move, nourish, connect, and be into something that's truly transformational for patients and providers and clinics and communities. Thank you so much for your time, and I welcome your questions.
Thank you, Liz. Well done. Woohoo! I'm seeing a lot of really great feedback in the chat. If you have questions for Liz, go ahead and get them in. The first question that I saw is, how do virtual sessions compare with in-person meetings? What doors are opened?
Yeah, great question. So before 2020, we were a diehard in-person organization. We said, you got to bring people together in person, and we would eat and dance and connect, and it was great. And then 2020 happened, and we rapidly learned how to do it virtually. And we are just now starting to do both again. So we're happy to explore pilots that have both qualities. But what I would say is that doing the virtual work evaporated some barriers. It created some new barriers around access, but particularly for our rural patients, those who have physical and or psychosocial barriers to coming to a place, even to the clinic, this has made it accessible and scalable in a way that it never was before.
Great, thank you. And last question, Matthew asked, this sounds great, but what are the programs that the coaches teach?
Great. So our coaches are trained in a platform that's based in motivational interviewing and cultural competency or humility and being trauma informed and group coaching. So the first hour of the program is large group. Everybody's together, 24 people doing movement and mindfulness and talking about nutrition. And then that large group breaks out into small groups so that a ratio of 1 coach to 6 participants has about 45 minutes together to really go deep and connect. The curriculum that we use is our own. And every week, what's called a spark is presented. It's not really a lesson. It's like an interactive learning activity that incorporates all 4 of our sort of pillars. So physical activity, healthy food, stress reduction, and social connection.
Great, thank you. There is one more question from Aliris from Mental Health Center of Denver, Liz, but I'm going to go ahead and bring up our next panelist. So you're welcome to answer that in the chat. Oh, there are a few more questions, so we'll make sure you get those so you can answer them. In the meantime, thank you. Well done.
Thank you.
And now, everybody, we have our last but not least, just alphabetically at the end, finalists for our pitches this evening, Still Life. So give us just a moment while we bring them up. We are so excited to hear from them as well. We just have so many great solutions this year. So let me bring up Still Life. Coming at you in the ether sphere right now. All right, welcome Sid and Sandy from Stell Live. Woohoo! Take it away, you guys.
Awesome. Can you hear us and see your screen okay?
We sure can. You look and sound
Great. Thanks, everyone. Appreciate being here. I'm Sid Candon, CEO of Stell.
And I'm Sandy, COO of Stell.
And our mission at Stell is to simplify connected care for patients, care teams, and device makers. 90% of US's healthcare spend is attributed to chronic conditions. Although it's well understood that measuring a single vital per your chronic condition and partnering patients with their care teams can significantly improve patient care and reduce costs, workflows and infrastructure often get in the way. And this is especially true for patients experiencing the digital divide and challenges when adopting new technology. So as technology advances, we need to be mindful of the patients that we risk leaving behind. Nearly half of lower income Americans lack home broadband. Over 40% of Medicare beneficiaries lack smartphones. And even if patients aren't comfortable with technology, we found out earlier this year that 100% of patients are at risk for having their PHI leaked. In an ideal world, patients would simply take their vitals and care teams would get the data in their existing and preferred systems. And they'd be able to do it without Wi-Fi, without smartphones and applications, and without risking leaking data, sensitivity, and sensitive information. Well, we built Stell so patients can do that. Stell's Vitals Hub is this little black box that doesn't have any buttons or switches, just sits in the background and sends patients' readings to their preferred care team. Patients don't need infrastructure, tech experience, or even need to read or speak English. They simply take their vitals within 100 feet of the hub, and Stell takes care of the rest. Each Stell hub can connect and transmit data over multiple US cell carriers, allowing better coverage than modern smartphones. Stell created and patented a new passive and secure communication standard that takes the hassle out of Bluetooth. Our operating system passively picks up data from Vitals devices when used and transmits it to the care team. And when I say Vitals devices, I'm talking about all the fan favorite scales, BP cuffs, thermometers, glucometers that you can think of, and also allow new devices like PNR, spirometer, lung monitors to come to market rapidly for patients that are experiencing the digital divide. On the care team side, all that's needed is to associate the hub to the patient. And care teams can do that simply by scanning the barcode on the box right into the patient chart or typing in the ID into the chart. The data then flows exactly where they expect it, right into the patient records, without any hassle or extra steps. So putting that all together, during patient enrollment, an order starts from the physician where they select the vitals that a patient's gonna use, and they select the program's preferred way of deployment. So either a patient picks up the device or is discharged with the device. A home health nurse can trigger a patient response and set up at home, or the patients can have it shipped to them. Once it's in the patient's home, they simply plug it in and take their vitals. And then lastly, the data goes right to the care team responsible for monitoring it. And they're free to escalate and come up with their own flows as they feel flexibility to, without being beholden to an external vendor or external processes. At the end of the program, the patients can keep their Vitals devices and they simply return the hub. The hubs can be reprocessed and reused between patients to really maximize ROI. When I say maximize ROI, I'm sure you guys have heard a lot of the Vitals pitches from other RPM service providers. It usually involves thousands of dollars in leasing fees and service fees and integration fees. We believe in a much simpler model. So the hub is $130, and all the services that you heard advertised, just $10 per month. We did this to promote scalability and allow programs the freedom and flexibility to turn pilots into full-fledged scalable programs. And we feel really grateful and privileged to have the opportunity to support a number of programs. To date, we transmitted over 1 million vitals from high-risk patients experiencing the digital divide right to care teams' records, and have deployed thousands across the country, from the volcanoes of Hawaii to the mountains of Colorado to the islands of Maine and in between. I'll hand it to Sandy to share more.
Thanks, Sid. You know, as a nurse and healthcare system CEO located in a very underserved community, I would have cut my arm off to be able to have a cost-effective device like the Stell Hub that could easily reach my most vulnerable patients in helping them manage their chronic diseases. So I want to talk with you about a real use case where STEL made an impact and talk to you about the real results that both the patients and the care teams experienced. We did a pilot of 60 patients. They were high-risk CHF patients. They each had a hub and 2 Vitals devices, and they monitored over a 6-month period of time. In that group, we saw a 50% reduction in their 30-day readmission rate, an 83% reduction in their 7-day readmission rate, and 3-day readmissions were eliminated completely. The impact on that organization on their pay for value contracts was over $60,000. And in addition, on the ambulatory side, there was additional revenue to the program of almost another $60,000. We want to bring that experience to Colorado. We want to bring our experience to help you support pilots that reach the patients in your communities. We want to pilot with health systems, FQHCs, primary care providers, and home care providers who are already doing great work reaching underserved communities. We need to identify a provider partner at each site, a nurse care manager, and an IT program manager to help us make this pilot really successful. The total cost of the pilot is $68,000 to care for 150 patients in a 1-year pilot. The cost to each patient for the entire year is $450. That includes our STEL hub, 2 Vitals devices, and the mobile services to get those cellular results from the STEL hub into the clinical record. As part of that $68,000, our partners will get the benefit of our clinical implementation, engineering, and customer support experts, as well as access to our STEL community of customers. Now, in our pilot, we know that having the privilege of monies from the innovation grant would allow us to create a seed program that in the end would become sustainable. And we know that based on our past experience, that in a pilot of 150 people, even if it's across multiple providers, there's at least $150,000 of pay for value utilization monies, $140,000 of ambulatory fee-for-service monies, and uniquely in Colorado through your Medicaid program, access to home care reimbursement to the tune of $190,000. The STEL team is very experienced, but more importantly, they're each incredibly committed to making a difference in the lives of individuals who are underserved and vulnerable, yet still suffering with chronic diseases without the kind of access that you and we have to technology every day. And it would be our privilege to be partnered with Colorado providers. We're happy to take your questions.
Great job, Sid and Sandy. Thank you so much. Love what you're doing with STEL Life, such an awesome solution. So I'm seeing a lot of cheers in the chat, a lot of rah-rahs. And we do have a question for you from Tony. So 2 questions from Tony. Once plugged in at home, what is the overall setup time required? And part 2 of that question is, and how fast can you scale production on the transmitter/device?
Yeah. So yeah, it's as simple as just like plugging it in, and that's it. That's all that needs to be done for the setup. So it connects to cellular on its own, and then as patients take measurements from Vitals devices within 100 feet of the hub, we'll pick it up and send it right to your endpoint with the hub ID and the measurement payloads. So it's rapid and instant. In terms of production, we're actually scaling up our Gen 3 model soon, where we're going to do 100% of the production in the States, in California. So I think, can run about 10,000 units over 2 weeks. So yeah, we're looking for partners to rapidly scale.
Great, thank you. And next question is from Stephanie. How do you navigate areas where there is not adequate cellular service or broadband availability?
Yeah, so that's the part that we really want to challenge our company with and grow in that vertical. So far to date, we've created our own MVNO, and that's how we are able to get access to the multiple carriers. So won't name the carriers here, but if you have phone service from the major US carriers, the hub should access those networks. We also uniquely transmit the data over some specialized payloads to make it really low bandwidth and can work on voice over LTE networks. So we've deployed in like the Mojave Desert, the Adirondacks, really remote places where phones don't work, and just to test the connectivity and got data through.
Awesome. Thank you, Sid. Last question for you from Jeremy. Any plans for other EHR integrations?
Yeah, so we rapidly integrate and push data into your preferred system. So it could be your EHR into other endpoints. We have a number of Epic installs. We are in some testing with Cerner and some of the other popular EHRs. We go in through a interface engine typically, and it acts like a lab record. So most EHRs have a section called patient generated health data. You get that for free. We've gotten really seasoned with getting into those flows without taking any PHI or information to make installs really simple.
Awesome. Thank you so much, Sid and Sandy. Thank you, Still Life. Congratulations. Woohoo! Well done, everybody. Show them some love in the chat. Excuse me, choking on air, apparently. All right, so now is the exciting part of the evening. Well, not the most exciting part. The pitches are the most exciting part. We have a few final things. So first, we are getting all of our last minute bids in. So if you are watching this and representing a provider organization, regional accountable entity, payer, state department or agency, public library, community-based organization, if you're providing healthcare services in Colorado and you would like to cast a vote for one of these solutions, please go to this link in the chat. I will post it here. And fill out that form. You have about 5 minutes left to cast any final votes for our amazing top 6 solutions of 2021. So Augmentel, Coda Health, Hazel Health, MedTransGo, Open Source Wellness, and Still Life. Thank you all so much and congratulations. We will be taking a short break to deliberate. In the meantime, we also have a People's Choice Award. So while we are deliberating, we're going to go ahead and launch this poll. Feel free to put your People's Choice Award in there. Oh, wow, that is coming in hot. So I'm going to go deliberate. We're going to go review the results. If you are a provider organization and you want to get a bid in, you have minutes to go. So please go to that link on our website and cast your vote. And for everybody else, we will be back in 7 minutes at 6:50 to announce the winners. And feel free to continue getting to know each other in the chat, asking questions, hanging out, all of those great things. We will see you back here in just a few. Okay, everybody, hello and welcome back. We are very excited to announce our winners. We have 5 awards for this evening. And sorry, I was just getting some last information from Office of eHealth Innovation on the OHI's Choice Award. So first up, we are going to announce the People's Choice Award. So all of you voted while we were off deliberating. And so drum roll, please. People's Choice Award goes to Stell Life. So congratulations, Stell Life. Whoop, whoop. Well done. We're so excited for you. So congratulations to Stell Life on the People's Choice Award. Woohoo! All right. And also, Stell Life, congratulations. You have won a second award. So Stell Life is also the winner of this year's Governor's Office of eHealth Innovation Choice Award. So the OHI Choice Award goes to Stell Life for remote patient monitoring and addressing the digital divide and lack of access to broadband. So congratulations to Stell Life, winner of both People's Choice and the Office of eHealth Innovation Award. Woohoo! All right, so I'm going to go ahead and bring our, or Darby, if you would go ahead and bring companies up as I announce them. So we'll go ahead and bring Sandy up as panelists to celebrate them. And now I am also pleased to announce we're going to start with our $25,000 prize this year for the 2021 Prime Health Innovation Challenge powered by the Colorado Health Foundation goes to Hazel Health. Congratulations, Hazel Health. We are so excited to see more innovation addressing the health of children in school-based settings and improving that access and wellness and all of those things. So congratulations to Hazel Health. We'll be bringing you up here shortly. And then our second place winner is MedTrans Go. So congratulations, MedTrans Go, on the $50,000 prize for addressing transportation, medication delivery, interpretation, and telehealth service barriers and reducing no-shows and improving access. So congratulations, MedTrans Go, on the $50,000 prize. And our $75,000 prize for this year's challenge goes to Open Source Wellness. Congratulations, Open Source Wellness, on the $75,000 prize. Woohoo! We're bringing you all up here. So congratulations to Open Source Wellness, MedTrans Go, Hazel Health, and Stell Life. If we could get Stell Life up here as well. Thank you all so much. And I do absolutely want to, before we give a few moments to our winners, Dash from Coda Health and Marty from Ogden's Health, both two amazing solutions. Tons and tons of interest in the community. This was a very close year for judging. So if you did want to learn more about Coda Health and Ogden's Health, please join us. And in the meantime, congratulations to Open Source Wellness, MedTrans Go, Hazel Health, and Stell Life. Woohoo! You are this year's winners. So that is so exciting. Congratulations. Thank you again so much to all of our hosts and judges and providers and all of you that made time to join us this evening, and to Colorado Health Foundation for making this event possible. So congratulations, everyone, and to our winners. If you guys want, you can feel free to say a few words, make a few comments. Woo! I see we've got Josh in the car. Very cool. Lots of nice congrats in the chat. So well done, everybody.
Well, to say thank you. I happen to be with my son, so it's like perfect timing. He's holding the camera, and so appreciative in the spirit of supporting kids. I'm supporting my son to get to soccer practice. So thank you, Prime Health Challenge.
We love supporting professional parents and parent professionals. So love seeing your kids. Congratulations again. Wow. And to all of you that joined us this evening, I'm just seeing so many wonderful comments in the chat. Just again, so much love to this incredible community. Thank you so much. Year after year, we come together, work together, learn from each other, and find really exciting and innovative ways to keep improving healthcare in Colorado. So thank you so much. Congratulations, everybody. All of you know me, pretty sure. I'm Rachel Dixon, Executive Director of Prime Health. My email is rachel@primehealthco.com. Darby's going to put it in the chat for me, or maybe Leah. If you were watching tonight and you want to learn more about one of the 6 finalists, Coda, Augmentel, Cell Life, MedTransGo, Open Source Wellness, or Hazel Health, shoot us an email. We would love to connect you. They're all amazing solutions and super friendly and excited to make an impact here in Colorado. And Matthew, yes, I'm not sure that I am ever enthusiastic enough. So appreciate that. Got to keep the energy up. We love innovation. Woohoo! So thank you. Congratulations, everybody. We're going to go ahead and turn it into a meeting now. If you want to chat and all of those things, I'm pretty sure I know how to do that. You're welcome to hang out and say a few words to our winners and our finalists, or chat amongst yourselves. So I'm going to mute my video so you don't watch me do that. But winners, go ahead and chat.
Thanks, Rachel. Thanks, Prime.